Right now, as the COVID-19 pandemic continues to affect our communities, fear, mistrust, and misunderstanding are creating a challenge to get people vaccinated. Tonight, we take a closer look at COVID-19 and the impact on communities of color. Good evening, I'm Valerie Pritchett. Over the next half hour, we'll explore why people of color are reluctant to get the vaccine and address the fear and myths that surround it. But first, let's take a look at how this virus is impacting communities of color. Since the pandemic began, COVID-19 has had a disproportionate impact on communities of color. More than 475,000 Americans have died. African Americans have died at 1.5 times the rate of Caucasians. And when it comes to the vaccine, a February survey by the Pew Research Center shows African American adults are the group least inclined to get vaccinated. Only 42% reported that they would get a vaccine. That's compared to 83% of Asians, 63% of Hispanics, and 61% of Caucasians. History and mistrust play a role, but so do chronic health issues, misinformation, and accessibility. And joining us now to address the concerns and to clear up that confusion, Dr. Stephen Henderson with Penn State Health Internal Medicine, Dr. Bolanle Liman, Chief Medical Officer with Hamilton Health Center, Dr. Cherie Livingston, the OBGYN Chair at UPMC Lidditz, Dr. Cherise Hamblin, OBGYN with Penn Medicine Lancaster General Health. I want to thank you and your health systems for coming together tonight for this important conversation, doctors. And let's start off with those questions. What are communities of color, and especially African Americans, why are they not getting vaccinated? Dr. Henderson.
Thank you, Valerie. Yes. It's a complex question and complex answer. As you stated clearly, in the Kaiser Family Foundation, they found 35% of African Americans will not get the vaccine. So why is that the case, and what can we do to change the narrative? Well, we want to address that is vaccine hesitancy and also vaccine equity. So vaccine hesitancy, as you mentioned clearly, there's a lot of historical distrust that the African American community have from past history of the Tuskegee study that's been unfortunate stained the Black community from 1932 to 1972 that we have to address and acknowledge. And also the Henrietta Lacks case, that's also the Black community reference, and I'll defer to my OBGYN colleagues to talk a little more detail about that. But there's a lot of misinformation out there. So some of my patients believe that the vaccine has a microchip in it, which it does not, that the vaccine can give you the coronavirus, it cannot, that the vaccine can change your DNA, it does not enter your cell. So we first need to understand the concerns, realize the historical facts, but also let's see, why is that the case that they're not getting the vaccine? Is it vaccine equity and awareness? So
okay.
We must make, okay.
Thank you, sir. And we mentioned a moment ago that COVID-19 can be more deadly in people of color. Dr. Liman, talk a little bit about that.
I think that's in large part for two reasons. One is the comorbidities. So unfortunately, people with comorbidities are at higher risk for complications and then subsequently death. And that is one of the reasons that the phase 1A was expanded over a month ago to include patients with multiple comorbidities. So I think that that's the main reason.
And also, let's talk specifically about the fear. We touched on that with the medical system itself. There's a history we heard with the Tuskegee Airmen and the syphilis study that they did, chemical experiments in the 60s, general mistrust. Dr. Hamblin, talk a little bit about that.
Well, I'm an OBGYN, and so I've taken care of women. I talk about trust all the time. And I like to use relationships as a point of comparison. Trust is built over time in any relationship. And if you have experiences where you feel a partner is not trustworthy, you will have suspicion. And I think that there's historical information and historical things, but then there's also the current state. And so if there's, there are current things that make it difficult or that continue to engender that mistrust. And so I think the medical community, this pandemic is a perfect opportunity to build trust through positive interactions, through a different experience than what has been in the past for communities of color.
Yes.
And what I mean by that is to say that if we recognize that there has been a disproportionate impact in a negative way for communities of color, then our response and our care of communities of color should be showing a redoubling of our efforts
Thank you,
to
Doctor.
reach communities of color with vaccine, with testing, and with mitigation strategies.
Thank you, Doctor. And just super quickly, Dr. Livingston, when it comes to these vaccines, access is an issue sometimes.
Access is an issue, and all of our facilities are working extremely hard to distribute the vaccine appropriately. There are many programs. UPMC has a UPMC 10% program where we look to get vaccine out to federally qualified health centers. But more importantly, the goal is to get the vaccine out to communities significantly impacted by coronavirus, like the communities of color.
Yeah, and we'll talk a little bit more about that. Thank you very much. We have much more to talk about. Up next, we clear up some of the myths and concerns when it comes to the vaccine itself. And later in the show, we'll answer your questions about the virus and the vaccine. Stay with us.